This instructional course lecture, which I'm contributing to, is When the Physician Becomes the Patient, Considerations for Work, Life, and Leadership. What are the personal considerations that arise when a physician or staff member has a medical issue, and how to support them? This is presented at the American Academy of Orthopaedic Surgeons in Las Vegas, March 10. I have nothing relevant to this talk to disclose. You have cancer. Immediate thoughts, emotions, mindset. As an orthopedist subspecialized in sports medicine, I diagnose, communicate, implement treatment plan, and then I fix it. Mission accomplished, done. Follow the patient, get them back on the field. Cancer diagnosis is much different. There are many unknowns, uncharted course, and the mission is less possible to complete. With whom do I share my cancer diagnosis? As an employee of UK healthcare, there are certain people I must inform. My chair, clinic administrator, family, select friends, my forum family, group of female orthopedic surgeons who practice sports medicine, and selected peers and mentors. I did not share this with fellow attendings, residents, peers, or patients. How to talk about it? As a cancer patient, I know that you should let the patient lead. If you're in the family, friends, in that group that the patient with cancer tells you about, you should listen. Listen. The patient should surround themselves with positive energy, creating a home court advantage, kind of like in surgery. So when I told my husband, he was in Florida and I was in Lexington at the time, he emailed his family about my diagnosis. So all of a sudden I'm getting emails and calls from his family, my in-laws, about how sorry they were. He thought he was doing something to help me, but let the patient inform who they want to inform. It's the patient's story, and you need to be supportive. Don't just say, oh, you're going to be fine, you're tough. A lot of emotions to work through. Woody thought he was doing the right thing, but it was not. Men and sensitivity in my journey. Men's reaction, don't let the bad news in. Run, isolate. And he wasn't really very supportive. I think he was afraid. I was usually the person who fixed everything, whether it was in medicine, I was the go-to person to get things done at home. So once I was in more of a unable to control my own circumstances, he got scared. Journey through cancer, the diagnosis and treatment, what helped me? Talking about my diagnosis, treatment, and feelings, receiving cards, presents, and gifts, walking and being outside in nature, getting the mindset and regaining control. It was very important for me to manage treatment options, which surgeons, which facility, which radiation oncologist and facility, and being informed. How to help yourself. Take anti-cancer action. Reduce inflammation. Choose foods that detoxify. Understand the effects of certain foods on cancer. Stop hormone replacement, if you're on it, which I was. And understand your treatment options. Meet the oncology team. The surgeon that I saw in Lexington stated I did not need to see anybody in the oncology team. They would take me to surgery if I wanted to go the next day, take me and then get the job done, and then I'd meet with the oncology team. Wrong. You really need a game plan and to be comfortable with your team, not just the surgeon alone. Read articles and books and discuss the treatment with cancer patients and friends. Keep a journal. Read books. A lot of books out there on the brink of everything. A lot of cancer books, breast cancer books. And keep a journal. Amazing, the Anti-Cancer, A New Way of Life book by David Servan-Schreiber. I was unaware of the inhibition of cancer cell growth by certain foods, particularly garlic, leeks, scallions, Brussels sprouts. This goes along with our inflammatory world in orthopedics. Anything to reduce inflammation, reduce cancer. Summary of a detoxified diet, tell you what to reduce and what to replace it with. What about the principles influencing factors on inflammation? This should be in our toolbox for our patients with arthritis. So try reduction inflammation diets like Mediterranean diet, Indian, Asian, and also laugh a little bit, be lighthearted, serene if you can. Hard to do with a cancer diagnosis. Take a walk, clean environment. Breast cancer. You have cancer. Really? Not me? Yes, I have breast cancer. Say it. It's an undrafted, uninvited new member of the team. I had breast cancer. It was a roller coaster of emotions. Why me? Why not me? There's always a delay in communication, biopsy, etc. We had an ice storm the week my results came in. The hospital was closed, but fortunately my OBGYN called to give me the news. Books. Read books. Cards that people sent me really made a difference. Write down your questions so you can get them answered. So this is my story. The first surgeon said, "We will take care of you, get you on the schedule. You don't need to see anybody else. Go back to work in 5 days." I really knew I'd probably be okay physically, but mentally I was a wreck. So I can go back and start doing ACL reconstructions in 5 days. Second surgical opinion, I took control, made the decision to travel to Boston, to Dana-Farber for my surgery. I had friends that were advocates and provided very positive support for me in Boston. So I was confident I made the right decision. Here we are at the Brigham, getting the imaging studies that are needed. I created a home court advantage with friends, fellow orthopedists, a dog. You got to create that home court advantage, whether it's in your own operating room or in a situation where you're being operated on. Mammogram for seed localization, Dana-Farber. Dana-Farber is an amazing place. This is Joe Hannafin, who is a patient at Dana-Farber and has raised a lot of money for Dana-Farber in the Pan Mass Challenge, which is a 2-day cycling event. All the proceeds go to Dana-Farber. The amount raised 2021, $64 million, and they've raised $114 million since the start of the COVID pandemic, February of 2020. Pretty amazing. Museum of Fine Arts, seems like we see breasts everywhere. So this is where I visited while I was in Boston awaiting my surgery. And you can see here where the female body is a landscape. Surgery during COVID was interesting. My 2 friends dropped me off. The surgeon called my friend, but she missed the call. And then they picked me up. Drive-through surgery, forms, and more forms. COVID tests. Pretty stressful for a patient who happens to be a physician being operated on during COVID. Radiation therapy. I picked songs to listen to during each treatment. I had a little control. That made me feel good. These were some of the songs that I picked. Make You Feel My Love. This Girl Is on Fire. Pretty appropriate. Rise Up. Be Brave. I Am Woman by Helen Reddy. The radiation oncology team had never heard that song. Maybe I even educated them a little bit. So if you can gain one little piece of control, that's something good. You can listen to music during your radiation therapy treatments. I did that for a month. The treatments were very short. Give them a Post-it with a couple of songs, and we'd change it every day. Control. This was the radiation machine, which is a little intimidating. Used to fluoroscopy and arthroscopy towers, but not this. It was a cool place to park my little Porsche. Again, I felt in control, but that one got me cancer center patients only. That was me. Still is. This is a diploma I never really wanted to have. Congratulations. You graduated from breast cancer radiation treatment. Determination, courage, tolerance, and perseverance. It made me a little tired, but couldn't really get an explanation why that is from my oncologist. So it took a few months to get back to normal. I did take about 2 weeks off from the office. Definitions needed to be a cancer patient yourself. Strong. People said or wrote I was the strongest person they know. I did not think I was so strong after a cancer diagnosis. Tough. Grit. I like that word. Change. Control. Character. Resilience. Leader. And you got to have faith. Follow up. 18 months, positive mammogram, calcifications in another area of the same breast. I had a stereotactic guided core biopsy. We always have fear, or I always have fear of recurrence. Is a cancer patient ever cancer-free or truly cured? So every 6 months I have a scan. Do I have scanophobia or scan anxiety? I think I have scan anxiety. The biopsy was negative. Follow-up mammogram in 6 months. Lucky acorn. I'm a member of the Blind Squirrel Society, which is Dr. Andrews' Society for Sports Medicine Fellowship. Blind squirrel in the woods gets an acorn every now and again. So when you start looking at articles, my husband, again trying to be helpful, sent me this. Breast Cancer Treatment Rethought. This was an article from the New England Journal of Medicine. Came out a month ago. Rethinking, do you really need radiation? And the results were 1,300 patients, age 65 or greater, follow-up for 5 years. What were the survival rates and what were the recurrence rates? So the survival rates were the same, equal with or without radiation. However, recurrence rates, and this is only 5 years, 10% without radiation, 1% with radiation. So is radiation a good insurance policy and assurance to the patient that she has done everything to prevent a recurrence? I think so, and I would do it again. It's interesting to look at articles and how much the treatment of breast cancer has changed over the years. This was a recent article in the Wall Street Journal. A medical historian confronts breast cancer. So this medical historian was diagnosed with breast cancer, and she reflects on what women went through many years ago, through generations, that have really helped us advance in the treatment of cancer for women. Nowadays, there is no longer one-size-fits-all approach to breast cancer. For me, that is likened to in the ACL surgery. There's not one graft that fits all. So she had a benign cyst evaluated. MRI scan showed cancer, and away from that cyst, she traveled a very bumpy stretch of road, rutted with tests, results, second opinions, and a crash course in oncology. I've asked myself several times, why me? But then again, why not me? Reflections of advances in orthopedics and drastic changes in surgical techniques. I was a resident of the 80s, where we changed from arthrotomy to arthroscopy. Change is the only predictable thing in life. Some changes are better than others. You got to keep up. So when she looked back at the history of breast surgery, 1855, Lucy Thurston described the horror of a mastectomy without anesthesia. Hour and a half, she saw the surgeon's hand covered with blood. Alfred Velpeau, French surgeon in the 1850s, recommended removal of both breasts, no reconstruction. Sepsis caused death in 50% of patients. William Halsted, radical mastectomy, removal of the lymph nodes, chest muscle, skin, collarbone, shoulder. His quote was, big surgeons make big cuts. I think we quote Halsted in orthopedics as well. And then along came Röntgen with x-rays in 1895. Advances, diagnosis with MRI, mammograms, genetic testing, treatments with robots, scalpels, vaccines. It's all going to get better. Her surgeon, Dr. Paul Tharuchvam, his approach was true personalization. Tailor the treatments based on the molecular characteristics of the individual's tumor. Use vaccines and immune therapy, and that will result in less deforming and mentally altering treatments for breast cancer. Progress. What about the incidences and cost in the U.S. annually? In my world, ACL tears are about 250,000 in the U.S. The cost exceeds $2 billion. What about breast cancer in the U.S.? It's estimated that there are 100,000 cases in 22, National Cancer Institute information. The cost is almost $30 billion, $26.2 billion in medical services, and $3.5 billion for drugs. In 2019, there were 264,000 new cases and 42,280 people died, according to the CDC. Rate of new cancers by age, you can see here the age that is most prevalent is 70 to 74, followed by 75 to 79, then 60 to 69. 12.9% of women born in the U.S. will develop breast cancer, 1 in 8. It's interesting, there's an increased prevalence of breast cancer and all-cause cancer in female orthopedic surgeons. In this article in AAOS, May 2022, comparison with the general California female population found that female orthopedic surgeons had a 4-time greater rate of breast cancer than the general population. There's some protective factors, increased risk factors. Protective, the surgeons were younger, normal BMI, white, never smoked. Increased risk factor, the surgeons were older at the age of their first child being born, and fewer surgeons use hormone replacement treatment and for a shorter duration. So in this study was a survey of 672 female orthopedists, 52% response rate, U.S. population compared to female orthopedists based on sex, race, and age, standardized prevalence ratio, confidence in intervals. The findings, there was a 4-time higher incidence, or 189% greater, among female orthopedic surgeons compared to that of age-adjusted and race-adjusted general U.S. female population. More work needs to be done on the contributory factors, occupational exposure to radiation, additional research is needed. My maternal grandmother died 3 weeks after her hip fracture when she was 85. That's when I decided to take hormone replacement therapy after my menopause, and I was on hormone replacement therapy until the day of my positive biopsy for breast cancer. I stopped. I thought I would rather take risks for other problems, although I didn't really know the true information of I probably should have stopped hormone replacement therapy much earlier. This is Colon Cancer Awareness Month, March. My father died from colon cancer at age 74. He was a Dukes D classification at his diagnosis 5 years earlier. He was the same age as I was when I was diagnosed with cancer. We were both 69. Early diagnosis. Gentlemen and ladies, get your colonoscopies. My brother-in-law died at age 64 from metastatic prostate cancer. Gentlemen, please have your prostate checked out, whatever your healthcare provider decides how to do that. Physical exam in sports medicine, in my opinion, is the best way to make a diagnosis, not a test. These subsequent tests with MRIs are necessary. However, a rectal exam done by somebody knowing how to do it, or a knee exam, is very important and should continue to be taught. Journey through cancer, what helped me? Reflections, people, remembering friends who died, how strong, tough, and positive these women were. They never thought they would die, never. And these are some of them. Jane, Tina, Pam, strong women, fought till the end. What can I do to make cancer journey easier for others? I am happy to be available to listen, offer to go to appointments, surgery with cancer patients. Embrace each day. Make a difference for all those you can. Lead the way to share stories by creating links for communication about breast cancer. Emphasize the importance of early diagnosis and yearly mammograms for breast cancer. Early diagnosis is key. How has the diagnosis changed me? I have more compassion for others with cancer diagnosis. I want to be a patient advocate. I learned how little I knew about breast cancer, even as a physician, albeit an orthopedist. It made me more humble and kinder. I love life and live it to the fullest, every day. We are stronger than we think. We also must act and speak and communicate. St. Anthony of Padua, actions speak louder than words. Let your words teach and your actions speak. And Abraham Lincoln in his Cooper Union address, actions speak louder than words. Early diagnosis is critical to survival and restoration of normal life. Together we are stronger. It's not the strongest of the species that survives, nor the most intelligent that survives. It is the one that is most adaptable to change. Charles Darwin. Very true words throughout history. Carole King, in her song Beautiful, you got to get up every morning with a smile on your face and show the world all the love in your heart. Then people are going to treat you better. You're going to find, yes you will, that you're beautiful. You're beautiful. Thank you very much for your attention. This is my website. If you would like to visit it, please do. References: